So my task this morning, I'm Gary Ginsberg from the New York State Department of Health, and my task this morning is to do a very brief recap of some perspectives from yesterday in just a few minutes, and then introduce this morning's speaker. And then I will come back up to get us back oriented around our discussion groups. So we are going to be organized, as you could see, into sort of a cabaret style morning where we really will have a chance to have more of a voice and have a free-flowing discussion for about an hour organized around certain topics that we'll go over after Dr. Bazou's talk. So we'll get into that in a few minutes, but if you aren't quite sure what that breakout activity looks like, there is a part of the agenda book which is about session 3. We are now entering into session 3. And there are the table descriptions as well as who from the organizing committee should, and from the speaker group, should be sitting at different tables. So if you're in one of those groups and you haven't noticed where you're supposed to be sitting, please take a look at that so that each table is anchored with certain folks. And there's an outline of what each table is going to be doing. So that's important information. We'll go over that again. So yesterday was amazing in going from the micro world of cells and cytokines and toxic chemical pollution interactions at a cellular level to a macrocosm view of what can happen to populations and healthcare delivery systems and parts of the globe that are under stress from disasters. And so we went from the micro world to the macro world, and I think there's a lot of similarities or overlaps in terms of how these systems both need to be balanced. There's a lot of vulnerabilities, both at the micro world and on the macro scale, and that they need to be working well on each level and wherever the weak links in the chain are, that's for us to identify and to try to work out within our tables in today's workshop, to try to identify where the research opportunities are, where the weak links are, where the transdisciplinary work and translational work needs to occur for us to be building the strengths to support those vulnerabilities and make sure that at the micro level, the immune system host vulnerability is less of a factor, less of a concern, and at the macro scale, that the systems are in place to decrease the vulnerabilities that we see within populations confronted with infectious risk. So Dr. Neil Bazou from McGill University is coming to help kick the morning off by and he's got a fresh pair of eyes on this. He wasn't here yesterday. But he will get us started thinking about the macro side of this, the transdisciplinary translational part of trying to integrate the important factors that need to come together to make environmental epidemiology and infectious disease work on a better scale, and bringing in things like mercury and contaminants. So really a very nice integrative talk to get the morning started. So, Neil?